A weak pump creates a flood. I want you to forget medications for just a minute. Forget ejection fractions. Forget BNP levels. Let's understand the story first. Imagine your basement has a sump pump. Every time it rains, water slowly seeps into the basement. Normally, the sump pump keeps up. Water comes in. The pump sends it back out. The basement stays dry. Now imagine the pump gets old. It's worn out. It still works, just not very well. The water doesn't disappear. It starts collecting. Little by little, the basement begins to flood. Eventually, the water spills into every room. That's congestive heart failure. The heart hasn't stopped. It's simply become too weak to move blood forward as efficiently as it should. And when the pump can't keep up, fluid has nowhere to go except backward. Everything that happens next begins with one simple idea. A weak pump creates a flood. The whole disease in one picture. Here's the entire disease in one simple flowchart. The heart weakens, blood slows down. Pressure builds behind the heart, and when pressure inside blood vessels becomes too high, fluid begins leaking out into surrounding tissues. Think about squeezing a garden hose. Pressure rises behind your hand. The same thing happens inside the circulatory system. The blood isn't moving forward efficiently anymore. Instead, it's backing up. Where that fluid backs up determines what your patient looks like. If it backs into the lungs, they become short of breath. If it backs into the body, the legs swell. The liver enlarges. Neck veins become distended. Heart failure isn't just a weak heart, it's a traffic problem. Blood can't move forward, so pressure builds behind the blockage. Remember floods. I like memory words that actually describe the disease. For CHF, I use the word floods, because that's exactly what's happening. F stands for fluid backs up. That's the entire problem. L is lungs fill with fluid. O is orthopnea. Patients often tell you, I can't lie flat. They sleep sitting up because gravity helps keep fluid out of their lungs. The second O is oxygen drops. Fluid blocks oxygen from moving into the bloodstream. D stands for dependent edema. Fluid settles wherever gravity pulls it, usually the ankles and legs. Finally, S is shortness of breath, the #1 complaint you'll hear. Remember floods, and you'll remember the patient standing right in front of you. Left versus right heart failure. Students often struggle remembering left versus right heart failure. Here's the easiest way I found. Picture a busy highway. Cars are flowing smoothly. Suddenly, one lane is blocked. Traffic backs up behind it. Now imagine the left side of the heart is blocked. Blood coming from the lungs has nowhere to go. Traffic backs up into the lungs. That's left-sided heart failure. Now imagine the right side can't pump. Blood returning from the body backs up. Traffic builds into the legs, the abdomen, the liver, the neck veins. Don't memorize left versus right. Just ask yourself one question. Where is the traffic backing up? The answer tells you almost everything. Why are they so short of breath? Here's my favorite picture for pulmonary edema. Think about a dry kitchen sponge. It's full of tiny air spaces. Air moves through it easily. Now soak that sponge under water. Can air still move through it? Not very well. CHF lungs become wet sponges. Fluid fills the tiny air sacs called alveoli. Normally, oxygen crosses those thin air sacs into the bloodstream. But now, oxygen has to move through water first. It becomes much harder. That's why these patients feel like they're suffocating. The room has plenty of oxygen. The problem isn't outside the body. The problem is inside the lungs. They're trying to breathe through a soaked sponge. What does the patient look like? When a CHF patient rolls into your emergency department, they often look sick before you even touch them. I remember breathe. B is breathless. They're working hard for every breath. R is rails. Listen carefully. You'll hear crackles as air bubbles through fluid. E is edema. Swollen ankles, swollen legs, sometimes swollen abdomen. A is anxious. Anyone struggling to breathe becomes frightened. T is tachypnea. Fast breathing is the body's attempt to compensate. H is high blood pressure. Many patients present with elevated blood pressure because the heart is working against increased resistance. Finally, E is exhausted. Breathing is hard work, and these patients have been doing it all day, sometimes all night. Treatment. Drain. Treatment makes perfect sense once you understand the flood. Remember, drain. D stands for diuretics. Lasix helps remove excess fluid from the body. Think of opening a giant floor drain in that flooded basement. The water level starts falling. R is reduce preload. Nitroglycerin decreases the amount of blood returning to the heart and lowers filling pressures. It also helps reduce the workload on the heart by decreasing afterload in many patients. A stands for airway support. If the lungs are filling with fluid, breathing becomes the priority. I is improve oxygenation. Oxygen and CPAP help improve gas exchange while reducing the work of breathing. N reminds us about nitroglycerin when appropriate. Every intervention has the same goal: drain the flood, lower the pressure, make the heart's job easier. The labs tell the story. When I review the labs, I use the word heart. H is high BNP. Think of BNP as the heart waving a white flag. It's stretched, it's under pressure. E stands for electrolytes. Potassium and magnesium become especially important, particularly after diuretics. A is assessed troponin. Sometimes heart failure is triggered by a heart attack. You don't want to miss that. R is renal function. Poor cardiac output means poor kidney perfusion. Creatinine helps tell that story. Finally, T is telemetry. These patients are at risk for dysrhythmias. Continuous cardiac monitoring allows you to recognize deterioration early. The labs aren't random. They're clues explaining how well every organ is tolerating a failing pump. Nursing priorities. CHF patients require constant reassessment. I remember care. C is continuous reassessment. Listen to lung sounds often. Watch for improvement or worsening. A stands for airway and oxygen. Monitor oxygen saturation. Watch the work of breathing. Can they speak full sentences? Are accessory muscles being used? R is response to treatment. Is CPAP helping? Are diuretics improving symptoms? Is blood pressure responding appropriately? Finally, E stands for evaluate urine output. One of the first signs your treatment is working is that fluid finally starts leaving the body. You're not simply giving medications, you're watching the flood slowly recede. Case study. Let's put everything together. A 72-year-old arrives after waking suddenly, gasping for air. They can't lie flat. Their blood pressure is 198/104. Their oxygen saturation is 84%. You hear crackles throughout both lungs. Their legs are swollen. Instead of memorizing symptoms, follow the story. The pump weakened, blood backed up, pressure increased, fluid leaked into the lungs. Now oxygen can't cross into the bloodstream efficiently. Everything fits together. Your priorities become obvious. Sit the patient upright. Apply oxygen. Prepare CPAP if indicated. Establish IV access. Anticipate diuretics and vasodilators as ordered. Then reassess. Because in CHF, you're always asking one question. Is the flood getting better? 3 pictures to remember. As we finish, I don't want you remembering a list of medications. I want you remembering 3 pictures. Picture number 1. The weak sump pump. A failing heart can't keep blood moving forward. Picture number 2. The wet sponge lungs. Fluid-filled lungs can't exchange oxygen effectively. Picture number 3. The traffic jam. Blood always backs up behind the weak side of the heart. Those 3 pictures explain almost every symptom your patient has. Remember our 2 memory words. Floods. Fluid backs up. Lungs fill. Orthopnea. Oxygen drops. Dependent edema. Shortness of breath. And remember drain. Diuretics. Reduce preload. Airway support. Improve oxygenation. Nitroglycerin when appropriate. One final thought. Don't think of congestive heart failure as simply a weak heart. Think of it as a weak pump causing a flood. Every symptom comes from fluid backing up, and every treatment you give is designed to drain the flood, improve oxygenation, or reduce the workload on the failing heart.